Here we go.
Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities. And it's going to be really an amazing experience. And I look forward to you joining me on the jar.
Hello, everybody. Welcome to Mental Health Today. I'm your host, Ken, and I've got Kurt Schmidt with me here today from the Peer Network as kind of my guest. It was a fun little video. Haven't played a mental health intro in a while, so a chance to see that video again. The van, really a story about driving around the country and hearing people's stories in their homes. And went to 96 cities, interviewed 330 people with this big jar of questions, and along the way saw the mental health crisis, which caused me to start this podcast to learn. One podcast led to another podcast, kind of let me learn more about the mental health crisis in America. And really, I was focused on the industry and how the industry is attempting to kind of help people and where we meet them. So it was a really interesting process to come to see face to face what the mental health crisis is. Along the way, I found an opportunity to become a peer support specialist, and I did that test and took the program in Nevada. And I was pretty impressed because it does seem that people with a lived experience and don't have to be clinicians to help each other, right? We don't have to be, we're humans. We don't have to, you don't have to have the certification to listen and to share your own story. And so people can find some value in finding out, I think in the biggest way is you're not alone. And, we're all going through something at some point, carrying some heavy loads and trying to get through some stuff. So, Kurt and I came across each other. Kurt, welcome to the show. Thanks for taking time out.
Hey, Ken. Yeah, thanks for having me. I'm excited to be here and share a little bit about what we're doing here. So thanks.
Yeah. As I mentioned, as we talked before we started, Kurt, just the sheer volume, the sheer number of people struggling, over especially with COVID, kind of accentuating that and bringing out, I think anybody who was on the edge certainly felt some tougher times in COVID. We're still even coming out of it. I think it's still a bit rough. And, I think maybe you can explain a little bit to the audience where peer support specialists kind of fit in, and maybe your own little story of how you found this idea, especially being a clinician.
Sure. Yeah, so maybe I could start by explaining what peer support is a little bit.
Yeah,
I know you
that's
touched
cool.
on it, at the beginning, but peer support it's a form of support for people that are struggling with mental health or substance use that uses people with lived experience with those same issues. So
Mhm.
certified peer support specialists are people who are typically in long-term recovery from mental health or substance use, and they go through training and certification to provide support to individuals who are struggling with similar
Mhm.
experience. So it's like you mentioned, Ken, it's not a clinical role. It's really based on shared experience, and there's training that goes along with that. But peer support it's kind of catching on as a go-to intervention. I mean, there's a lot of evidence and research to support its effectiveness. It can reduce ER visits, increase engagement in treatment, reduce hospitalizations,
Mm.
improve quality of life. So it's not just kind of this great idea. There's definitely a lot of evidence to support it. And, how it works is it breaks down a lot of barriers, because I think there's a lot of stigma associated with seeking support for mental health or substance use. And so a lot of
Yeah.
people just don't seek the support, and where peer support comes in is, it allows people to relate on a personal level and understand that the person that they're speaking with has kind of been there and been in a similar situation and has come out on the other side, to live a healthy, productive, happy life. and really just kind of model what recovery can look like for those people. So it definitely breaks down a lot of barriers for those that are hesitant to seek support. And, I think there's a huge gap, as you pointed out. I think COVID was a terrible time for a lot of people, but it was also beneficial in the fact that it kind of shed a light on some of the mental health issues that are, being overlooked. Probably added to that, in a significant way. But it allowed for the mental health crisis to kind of be a and people to really take a look and be like, hey, we need to look at alternative solutions to people getting support. A lot of
Yeah,
times now,
absolutely.
seeking clinical support, which peer support does not replace that. To be very clear, it does not replace medical intervention either. But there's a lot of long wait times to get in with clinicians,
Hmm.
doctors, and peer support can be a great standalone support for people that don't maybe need those higher levels of care, but also just bridge that gap while people are
Yes.
trying to find, a psychiatrist or a licensed therapist that specializes in whatever type of support they need. So um, there's a huge opportunity for us to kind of increase awareness about what peer support is and how it can help, and break down some of those barriers for people that are hesitant to seek support.
Yes. Yeah, I mean, agreed. It's seems a lot less onerous when you're going to see somebody up here. You're scheduling that maybe a first time you're reaching out, as opposed to kind of that big stretch of going in to see a doctor. Real a clinician. It's a nice
Right.
first step.
Yeah, and I think, kind of back to your question of, what we do and how I got into this,
Yeah, yeah.
you
It's
know,
curious. How did you find yourself? Because you must have seen something.
it was interesting. I was talking to a friend of mine. I haven't always worked in the field of mental health, but, I'm someone who is in long-term recovery. I'm a peer, that's how I started working in the field. And, it was
Okay.
during COVID when, I was struggling and I was contemplating like, hey, I want a career change, and I want to get into the field of recovery support, mental health support, and trying to figure out what the path of like least resistance was
Hmm.
to kind of get in the field, get my feet wet without necessarily going back and getting another master's degree. And a good friend of mine who's a clinical psychologist, he's like, you should look into peer support. And to be honest, I had never heard of it.
Yeah.
Um,
Yeah.
I was really unfamiliar with it, and I was familiar with recovery. I'd been a big part of my adult life, and just hadn't heard of it. And so I started looking into it. Similar to you, Ken, I'm here in Missouri, and went through the Missouri training program. Ended up working for a community organization here, and then went back to school full time to get my
Yeah.
master's in social work. So it was awesome. Like that's what I realized I'm passionate about, is like the peer side, because it breaks down so many barriers to people seeking support. When I started as a peer in the field, I worked a lot with drug court, DUI court, family court,
Oof.
people going through kind of that system.
Oof.
And as soon as people realized that I was in recovery myself, I immediately saw kind of the walls break down,
Yeah. Yes.
and I didn't see that when I got into more of like a clinical role. However, like as clinicians, there's mixed views on kind of self-disclosure and what you disclose and what you don't.
Yeah.
Um,
Yes.
and so, I if it came up in a session, like in a clinical setting, and a client asked me or something like that, I would share it. And again, I would see kind of the walls break down, where they were open up a little bit more about what they're struggling with. And so it kind of brings me back to really, like, my heart was always in peer support, because I knew that there's an opportunity to support people that are going through similar situations. And if they just knew that there were people out there that understand what they're going through, and they could talk to them kind of,
Yes.
as a peer, right? On the same level, not as this hierarchy of power where the clinician's kind of this, medical clinical professional. Even though there's kind of this unspoken power dynamic, I think, where sometimes clients don't feel comfortable or don't open up as much. And so
Oh, for sure.
I,
For sure.
yeah. And so that's why I knew my heart was in peer support, but it's tough because, we talked a little bit before the show. Peers are generally not paid very well.
Yeah.
They're sometimes an afterthought in a lot of clinical programs, or programs that focus more on like medication assisted treatment and things like that.
Mhm.
And they may throw a peer in there just for additional support. But it is sometimes, I feel like, an afterthought. And what we tried to do with the peernetwork.com was, focus on one thing, and that's peer support, and, empower our peers, and also kind of set the standard on peer support and the quality of care that we can provide to our clients. And you know, we're working towards that, and we're doing that, and we're starting to get our name out there a little bit, and really provide an opportunity for peers to grow with our organization, and then increase access to peer support. So you don't have to go to a residential treatment program, or don't have to be
Mhm.
involved in a court mandated program. It could just be someone struggling with problem alcohol use, and they want to talk to somebody who's trained and certified to kind of provide that level of support, but leveraging like the shared experience of, hey,
Yeah.
I've been there too, you know?
I think it's one of the good outcomes, I think, from COVID was clinicians actually becoming better paid. It becoming a career where you can, it's a good career. Financially, you can, I think a lot of clinicians were struggling financially before. It was not a great income career. It was really still an act of love. And I think COVID allowed that pay raise, kind of that income to kind of rise for them. So I think it did create a better space for peer support to kind of start that process as well. Kind of, and as as it gets a little bit more well known, I think there might be a spot for peer support, financially to do it and be able to make a career of it, or at least
Yeah.
worthwhile part time.
Right. And this, you kind of nailed it. I think, a lot of people assume that anyone that gets into this field that I know didn't do it for the money,
Yeah. No.
whether it's peer support or clinical
Or
work.
even clinical work for sure.
Yeah, or even clinical work.
Yeah.
But it's a hard job, and like, you're working with people that are going through a lot of issues, and it's tough to support people like that. And they clinicians or peers shouldn't be martyrs, right? Like, they should be paid. They're helping people, right? Like, I think they
Sure.
should be paid an equitable
Absolutely.
wage. And but yes, to your point, I think COVID, definitely increased demand on clinical services, where now there can be long wait times to get in to see a clinician. Um, Especially, if you're going through your insurance or even private practice. I mean, sometimes there's long wait times, and that's where I think the opportunity to engage, like with our platform, a peer support specialist, because it's affordable and it's evidence based, right? Like, it does help. And if someone needs that higher level of support, Well, peers are excellent at connecting people to resources because a lot of times most of us have navigated those resources,
Yeah,
that
exactly.
ourselves. So we can point them in the right direction. If that's, kind of building motivation to see a medical doctor to just get a wellness check, right? Or see a psychiatrist to, maybe there's some medication that's needed, or even if it's just meeting with a clinician to, address some other issues. Like that's what we do as well. But I think, you're right. Like it did help the field in the sense that, you know, there's a lot more people seeking support. So it, for the clinicians and those people, but there's still a big gap where people just either aren't reaching out, or they do reach out and it's just too long to get in, or they're not ready for a higher level of care. And this is a really great opportunity to uh, kind of bridge that gap,
Yeah, and I think the other area that I see as a real big fill in the gaps is just geographically. I don't know I can't remember the numbers, but like if you looked at North Dakota, South Dakota, Wyoming, Montana, the number of counties or how far you'd have to go to find a therapist if you live somewhere, and it's not possible to cover the gap, the distance to physically see somebody. And I think peer support could really fill in some of these geographical areas where people can't get to a therapist. One doesn't exist in their county. I mean, there's a lot of
Yeah.
counties. There's huge whole cities without a therapist.
Yeah, there's a huge need for that. And that's kind of why I mean, that's a big part of why I created the peer network, is our platform is there's no app downloads, there's no um, certain technology needed. It's really kind of a software as a service platform where people can just go to our website, um, sign up, which is free, and then just pay for the services that, like, as they meet with a peer. So it's like really straightforward. And so all that's needed is an internet connection and a device, like phone, tablet, laptop, whatever, and that's it. And it's all HIPAA compliant. So we made it super accessible, and it's kind of crazy because I'm here in Missouri, and of course, over time we've kind of reached out to different, like, Medicaid and things like that here in Missouri, and one of the requirements for them here, and I know this isn't the same for every state, is you need a physical location where people can come in. And we're, the majority of Missouri, just like North Dakota and the states you mentioned, is a rural state. Not everyone has access to
An
those
office.
services
Yeah.
nearby. And it's just, I think, to circle back to the COVID conversation, I think it shed a light on mental health, but it also shed a light on many deficiencies that
Yeah.
need to be addressed with access to support. And, you know, those are some challenges that we face, is like, how do we advocate for ourselves as an organization that, we can provide support when we're focusing specifically, on peer support and not, medication and clinical therapy. So I think over time that'll change, and the narrative will change around peer support, and it's already kind of becoming more acceptable, and people realize, like, hey, we see the evidence. But it's definitely, there's a lot of work to be done, and there's a lot of great organizations out there advocating for peer support. It may take some time.
It's going to take some time. What do you hope for? What's the kind of the dream vision 5 years? What does the peer network look like?
Yeah. So I mean, realistically, we want to be the world's largest, most impactful peer support platform. This is not just an issue that is in the US. It's a worldwide issue. We've gotten a lot of interest, believe it or not, from people reaching out from other countries about, hey, do we have these services there? Which we don't, but there are peers in other countries. So really to provide a platform that really has certified, vetted peer professionals that can support people no matter where they're at. And we kind of do that through leveraging technology, through education as we move forward, specialized training, and just make it more accessible. And a big part of that, which we're working through now, is trying to educate the public on what peer support is.
Yeah.
And that's why I'm
Yes.
grateful to be on this today, because it's an opportunity to do that. A lot of people aren't familiar with it. So just getting the word out there, and letting people know what it is, because we're not the only organization doing it, and we can't fill the gap. There needs to
No.
be other organizations that do it too, and there are. But I think us as a platform like the peernetwork.com is, we just want to create the most successful, largest platform for peers to provide their services, and make sure we get the ones that have the most experience and that are there to support and doing it for the right reasons.
I think you mentioned something earlier, and this probably is a great way to kind of keep that information flow going and stay in the top of the headline is the not just getting the certification, but beginning to put together some programs that are a little bit higher level. So the
Mhm.
state by state, they have some peer support certification, and then you mentioned there's a national one. It'd be interesting. So is that going to be part of your plans, or like continuing education that somehow maybe you create an association, your own association,
Yeah.
and then create your own curriculum, kind of like financial planners or something, an association dedicated to it, and then start to build a curriculum around it. You can become the standard, or make it
Yeah.
maybe not company specific, but you make it more industry neutral. But you guys can be spearheading it.
Yes. So it's interesting you bring that up. So we are, in talks with different companies and organizations to do something like that, which is exciting. So hopefully more to come on that. But yes, that ideally that's the direction that we would go,
Yeah.
because there has been a national model standard released by SAMHSA, which is kind of like the governmental agency that has oversight on some of these services.
Okay.
And so there needs to be like a streamlined approach, but then I think there's also an opportunity to really elevate the training and certification, not just to kind of a baseline level, but opportunities to
Right.
really dive deeper into different parts of support and treatment and things like that. So yeah, we are definitely working towards that. I mean, and there's a company that we're talking to that could be a great partner for us to really help us do that. But
Excellent.
one of the things too is, I guess what sets us apart is, we're small now. We really just started. I mean, I started the company in July of 2022, but most of the time has been spent kind of building our platform and just kind of word of mouth
Hmm.
networking. But we have the ability to support unlimited number of meetings at any given time. So, the technology side is there. And so now we're really just focusing on like building awareness about what we do so we can bring access to these services, because we're not limited by the technology side, so we know we can help a lot of people. It's just, it's just getting the word out about what we do. And this is a great platform where we could kind of educate the public a little bit about our services. And one other point I just want to make is that I think in the context of peer support, people think, it's helping the individual that's going through the issues, the person that's struggling with those issues.
Yes.
But peer support is really valuable in helping family members too, that have loved ones that are struggling, because oftentimes, family members don't know how to navigate that, how to support
Right.
the loved one that's going through those issues. And a lot of our team members, have gone through their own struggles and are in long-term recovery, but also have had children, that have passed away from these issues. And so they've been on both sides, like I myself, I'm in recovery from substance use, long-term recovery, but I also lost my father to alcoholism, 2 years ago. So it's like, it's not just about supporting the individual. We know how to support family members as well, and help them like set boundaries and navigate like what's the best way to support, and just be a sounding board for those as well.
I totally forgot about that aspect of the training.
Mm-hmm.
Yeah. Huge part, which I don't think
Yeah.
you get you don't get in therapy, because that is about the patient more. So yeah, very interesting. I forgot about that aspect. I interviewed quite a few people during the JAR,
Mm-hmm.
parents that lost kids, or kids that were kind of dealing with parents who had trouble. So I probably have a good 20 candidates for you for peer support specialists. If I go through you and I can go through
Yeah.
we can get on iTunes and go through the guests, and
Yeah.
I can cue you which ones to reach out to.
Or share my contact. Yeah.
Yeah,
Make sure.
I mean, one of the reasons I started this podcast, and I started a foundation for mental health, and really the ultimate goal of it is for around mental health, the JAR Foundation, and haven't really activated it yet. I need some solid revenue to get that going, or sponsors for these kinds of shows to fund us. But the idea was one lady that I met um, somewhere in North Dakota, and I was just so impressed. She had taken she was basically a peer support specialist. She had taken her lived experience, a few lived experiences, like some pretty tough stuff, and was opening up her own kind of little halfway house. It was next to some of the city resources, and just in a tough part of town. And she was opening up a little storefront, so where people could just come and talk and work stuff out. And it would be, basically a peer support house, peer support office, where people could come in with shared experiences and, could encourage each other. That motivated me to look into, how that gap where people aren't quite into the mainstream, even these kind of, little halfway house meetings that people do, are a struggle for some people to get to, or to, what do they do after it? Where do they go? How do they keep away from the bad influences that'll keep them, out of recovery and into abuse, or, a use. So yeah, I think there's a lot of people out there that, if they knew this was a possibility, they would go through the work to help other people.
Yeah, that's awesome. And we need that, right? Like there is no one organization that's going to be ever going to be big enough to support the need, right? And
Absolutely.
there's tons of great free resources out there. I mean, there's a lot of, with substance use, there's 12-step programs, there's smart recovery. Those were helpful for me. And that was a part of my story, but it's not everyone wants to go that route.
Yes.
And I think there's an important distinction that I just want to clarify, that sometimes I get asked a lot, is like, what's the difference between a peer and sponsor in
Yeah,
AA
yeah.
or
It's a great
NA, right?
question. That's great.
Um, and I think the big difference is training. Peers are trained in ethics, boundaries, confidentiality, um, understanding that there's no one path to recovery, whether that's mental health or substance use, and really just trained to meet clients where they're at, wherever that may be. Um, they may not be ready to stop using all substances, or maybe they're not ready to see a doctor um,
Yes, yeah.
to get support. So it's really about using kind of the foundation of peer support is motivational interviewing, how to kind of catch the client's change talk when they're talking about making changes for the positive, and like reinforcing that, and how to build motivation and desire to make better choices, or help set some goals that keep them on their path. So it is different. A lot of times with you know sponsors, and I'm not knocking it, because I that was a part of my story and my journey. It's kind of their way, and that's the way they
Mhm.
you do that, and that works for a lot of people. It helped me, but it doesn't work for everyone, and there's a difference.
Even the
With that.
numbers in there of even the numbers you talk to people inside the 12-step program, the numbers are tough, right? The
Yeah.
success rate is still really brutal. I
Hmm.
met I met, not long ago, I've met a couple guys recently who are in recovery from, substance abuse, but are still lightly using other lighter drugs, you know?
Sure.
So, heroin was the thing for this person, and they're off of heroin, but they still smoke pot and they still drink occasionally, not and like this guy said, "I never had a problem with alcohol, and I don't, I'm not an alcohol I don't drink
Mhm.
to escape. I drink, seldom." So it's interesting, and a guest of mine that I met in Arizona, this is his big mantra, is there are more we don't talk about the multiple ways to recovery, and everybody's journey is different. There's so many different ways to recover and to get better, and to be a functioning person and still, use something. And I think 12 steps
Sure.
is, absolutely nothing. And so there is there's going to be people all over the spectrum. So it's kind of an interesting idea that there are, reminder that there are many, many versions of recovery,
Yes.
and everybody's path is going to be different. And I think we need to, allow that space.
Yeah, and that's I, I'm sure they talked about it in your peer training, but the focus for us, I mean, just our team, I mean, is quality of life. It's not necessarily abstinence from, just in the context of substance use here, but
Yes. Yeah. Yeah.
it's not, abstinence may not be the right fit for that person right now, or maybe ever.
Yes. Yeah. Yeah.
But,
Exactly.
if
Exactly.
someone, like you said, Ken, if someone's using heroin on a daily basis, actively using heroin, they're probably engaging in other risky behaviors. They're probably at risk for a lot of health issues. So, if working with a peer can help that person, they're going to smoke pot once in a while or have some drinks, maybe in a perfect world, you got to be careful, right? Because it can open the door to other things. But
Absolutely.
that, that is not the focus. The focus is improving that person's quality of life, helping them, feel good about doing that, setting realistic goals, and helping them achieve that. And that's what peer support is about. Where there's no set path to recovery.
Hmm.
It's really about meeting people where they're at, helping them live the most healthy, productive, happy life, whatever that looks like for them. And then, keeping them engaged in whatever the recovery looks like for them, or whatever support looks like for them. We don't judge. I mean, I can attest to, you know, it takes sometimes it takes many times to figure out really like what your path is. For me, it took me many times. Um,
Hmm.
my story is not unique. And so we understand people have setbacks and things like that. We don't judge, and we're here to support because we've been there. We get it. Yeah. And there's many paths to
Interesting.
recovery.
Let's pull a question from the jar.
Okay.
Well, let's start thinking about see where the jar takes us. Okay. So a question from the jar for Kurt. Do you treat people differently at this age than when you were younger?
Great question.
Yeah. Do you treat people differently at this age when
I
you were
think I
younger?
do. Yeah. I think now I have more compassion. I think
Hmm.
I don't think I was not a compassionate person before, but I think, kind of at the stage I'm at in my life, where I'm at with my recovery. I'm a father, I have 2 daughters. It puts things into perspective. And, a lot of things I used to kind of look back on and say, oh, why that happened to me. I kind of look at those things now as like, first of all, it put me in where I'm at now and on the path I'm on now. But it also made me realize like that I was dealt a pretty good hand compared to a lot of people, and working with clients I've worked with, I, even though I've had my struggles, like, I'm pretty fortunate. And there's a lot of people that don't have the opportunities I had, or, had the parents I had, or, whatever it may be. And I think, yeah, I just have a different outlook on life. And, a big part of that for me is my faith,
Hmm.
which, I think, that's probably the number one driver for me is my faith. And, that everybody just needs an opportunity. And, yeah, I think we're all meant to be here, and we all deserve the best life that we have.
Yeah, and and funny is we're all right where we're supposed to be somehow. Compassion's an
Yeah.
interesting thing. You talked about compassionate, being more compassionate, and it is I feel there's like some kind of funny spectrum that we're on that, you think you're compassionate and then you go through another door and you find out you're only on, you're on a different scale, right? You're as compassionate as you could be. And all of a sudden you find out there's a different level or a different source. And having children certainly is that, opens a door and you realize, oh, okay, maybe I wasn't as I mean, you were as compassionate as you thought, but you didn't have a certain it wasn't all there. You couldn't see what it looked like 100%. And
Yeah.
probably for you working in the courts would have been a whole different eye-opening another door to stretch your definition of it.
Yeah. And and I'll speak from, my experience, when someone's actively struggling with, in my case, addiction and mental health,
Hmm.
I mean, we don't really have compassion for ourselves. So it's hard to have it for other people, And
Oh,
and
interesting.
I think part of my almost like awakening was when I really decided that, hey, there's no more like testing. Can I do this or that and see if I can, have drink sometimes or do whatever sometimes, and really like surrendered to, for me personally, it was abstinence from all
From
all
everything,
drugs.
yeah.
Yeah. Now caffeine's different, so don't, um,
That's
but
we're not counting
so
that.
yeah. So when I realized that, and then I saw the way, paired with kind of my faith and my belief in God, and I started to have more compassion for myself and give myself a little bit, more leeway. And then that translated into, me just caring more for others. I don't know if that makes sense, but,
Oh, totally, totally.
when it wasn't about me anymore, um, that's when I think that was like the biggest change on how I've treated others. It's hard to treat other people well when you're, you know, not treating yourself well. Or sometimes we do treat other people well and we don't treat ourselves well. It's kind of a interesting dynamic, but yeah.
I
Hopefully
wrote
that
I
answers the question.
absolutely.
Yeah.
Oh, it's great that was a great discovery. You mentioned compassion where it fits in that spectrum. So I wrote in my book, Dear God, there's a part of where you're with other people. The first part is yourself, book of self, and then this book of others. It's the trilogy of topics is acceptance, forgiveness, compassion.
Mhm.
So the theory being, that those are acceptance and forgiveness are the two, you know, it's the foundational part to get to compassion. And
Mhm.
you just kind of you got there in an interesting way, about compassion for yourself. And if you don't have that, it's hard to have it for somebody else. So I think it is that acceptance, right? You have to accept yourself, accept where you're at, and accept other people, as they are.
Mhm.
And then a lot of forgiveness going on. And then I think compassion's a natural outcome of those two. You get there, and then your compassion can be it can be infinite. Can be infinite. Let's
Yeah.
do yeah. Let's do one more question, and then I'll
Okay.
give you a kind of a chance to wrap up your thoughts and kind of
Sure.
see what we can do to kind of help the network. Okay, this is good because this is a peer kind of a little bit what we talked about from a peer standpoint, and then also relative to you because both your parents and then you being a parent. So, question from the jar for Kurt: what is something every parent should know?
Mm. That's a tough one. I think for, me as a parent personally is that, you know, my kids are different, right? Like they're different from each other. Um, and it's kind of embracing, you know, each of them as a unique
Mm,
person. Um, and I think as a parent, like let me backtrack here. When I think of this in the context of me as a child, like the son of
yeah,
my
yeah.
parents, if there was something I could tell them is that they did everything they could and they provided a great life for me despite the struggles I went through. I think both my parents, even though like I said, my dad passed away from alcoholism a couple years ago. I think they carry some guilt that and I had conversations with them that maybe they could have done things differently. And the reality is like we all could do things differently, but ultimately it's for us to figure out. And I had there were decisions I made and things that I did that I have to take ownership of. And like those were it wouldn't have changed if they would have done
Wouldn't have
anything
changed.
differently, you
Yeah.
know. And so I guess for my kids, I think that it's all about supporting them on like their unique path of like personal growth.
Mm,
It's just I don't pressure them to do things they don't want to do. If it's a sport, if it's a play, um, whatever it may be, I try to just stay super positive, create an environment in our house where it's laughter, it's fun. Let them be independent. Let them make their own mistakes. Um, and let them kind of build resilience, and I'm kind of losing sight of the question, but I guess for me as a parent, really, it's like being the role model of a man that I want my daughters to look up to. And one day, you know, that's who they see as,
Yeah.
as like, as someone that they respect and they look up to. And if, they get married one day, that's the standard that they expect. And, I recovery and, taking care of myself and those things and setting a good example is a big part of that. Um, but yeah, so I don't know.
Awesome.
I think I kind of went off on a tangent there, but
Question's just a prompt.
yeah.
Yeah, just a prompt where it's and those are for early in the morning on a Wednesday. That's a real question.
Mhm.
Those are and that's a good question for you, especially with your parent dynamic and now being a
Mhm.
dad. I thought that was a legit good pull.
Yeah, it was meant to be.
Yeah. Oh, the jar is magic like that. It's kind of funny. It does sometimes it's listening. Not long ago I had a guest they posted just during their own answer one of their own just before we started the jar. Um, they asked themselves a question, and sure enough, I pulled the exact same question from the jar for them 10 minutes later. S-
Oh,
But bananas.
that's crazy.
It was I and I don't what like that was just supernatural, right? Sometimes when you see stuff like that, because there's 400 questions in the jar, there's a million questions in the planet, and
Right.
that in a conversation they would choose a question that was exactly worded the same as the jar. It's quite funny.
The
Um,
synchronicities and
the,
yeah.
s- the synchronicities, you talk about faith, and you have whatever that definition of faith would be for you, whatever that spectrum of the way you'd look at it. Um, it's a real thing. It's out
It
there.
is
We're
the
all
real thing. And, I don't force that on anyone, but I mean, there's times when I ask questions and I get answers, and it may not be, you know, the way I'm looking for the answer, but
oh,
it's
for sure.
crazy how
Yeah, for sure.
those,
It's not the same. Yeah, yeah.
you know,
We get you get the answer you're supposed to get. Maybe it's not the maybe you didn't ask the right question.
yeah,
Don't put that on the universe. You know.
yeah.
Oh, for sure, it's funny. Great. Any kind of how about some closing thoughts? And I think for sure the www dot thepeernetwork.com
Mhm.
right in there, and I'll make sure to get that in the notes so people can see that. If you're listening on you can just drop down. If you're listening on an audio version of this, you'll be able to drop down and pick that up in the notes.
Yeah, I mean, as far as closing, thanks for having me on. I really appreciate the platform and love what you're doing. You know, closing notes for me is just for anyone out there that's struggling with any of the issues we talked about today,
Mhm.
whether it's mental health or substance use or you're a family member, I'm not gonna. There's a lot of resources out there. We're just one, and we're accessible. And I think you can always check us out, but there's always resources in your community. If you have
Mm.
questions or anything, we understand that, maybe our services aren't for everyone, but I will say this, we get a lot of phone calls. I answer a lot of those phone calls. And if we're not the right fit, I make sure I point people in the right direction.
Yeah.
So just reach out. There's a lot of people that are going through similar situations, and just the act of initiating that first step of seeking support. I mean, that's liberating in itself. And then
Wow,
following
it's got
through,
to feel great.
yeah, feels great. So just take that first step and talk to somebody, and you can check out our platform. Um, it's free to sign up. You just pay for the service that you want. Hopefully soon we'll be partnering with insurance companies and We network for a lot, and so hopefully we get there, and then it's just even more accessible. But happy to point anyone in the right direction.
Super. What was I was going to say? I think that was about it. That was all I had. It's awesome.
Yeah, that's great. Thanks.
Hey, hang on for 30 seconds and I'll see you on the other side.
Sounds good.
Yeah, big thanks to everybody out there. Especially we got Diane Edgar. Give us a little bit of love. You know, every once in a while we get some prompts from people out there listening somewhere. But a big thanks to everybody who's still listening to, especially on the audio versions, recorded versions. Just follow along. Drop down if you thought we said something beautiful. Drop down, give us some stars. And if we really upset you or really made you excited, write a note. Get in there and write a note. Kurt, hang on for 30 seconds. See you on the other side.
Sounds good. Thanks.
Yeah, loose, baby.
But we're about to go and make this vessel with these great professionals in public glass. We're not part of the community, but we're from the outer family of glass blowing. Yeah, we're going to go make a magical giant jar with optic lenses so that if you turn it, it changes all the time. So if you change the way you look at things, the things you look at change.